Hi, I'm Master Student Lo Kai Lun. Thank you for joining me today for the presentation of research methods in science. The idea I've come up with, also my title is Clinical Characteristics of Cholinergic Urticaria in Malaysia. Cholinergic urticaria is a common chronic inducible urticaria that is caused by increased body temperature. However, the clinical manifestation and pathogenesis are incompletely understood. To date, the only things that we know is the mast cell and histamine is involved in this pathogenesis. The cause of cholinergic urticaria is also uncertain. The objective of my study is one, to determine the prevalence of cholinergic urticaria in cholinergic patients in Malaysia. Two, to investigate the clinical characteristics of cholinergic urticaria patients in Malaysia. So what is urticaria? Urticaria is commonly known as hives, is a skin allergy reaction caused by various stimulus. They are mechanical, thermal, and others. Urticaria occurs in 15 to 25% of individuals at some point in life, normally at the age of 16 to 29 years old. The clinical features also the symptom is rapid appearance of wheals, redness, and itchiness. Urticaria can be classified as acute or chronic depending on the duration of symptom. If the duration is less than 6 weeks, it's called as acute urticaria. If it's more than 6 weeks, it is called as chronic urticaria. Chronic urticaria can be subdivided into chronic spontaneous urticaria and also inducible urticaria. Inducible chronic urticaria is caused by physical stimulus, like scratching for dermatographism, cold, hot, pressure, and others. Cholinergic urticaria, the cause is the increase of body temperature. Anything related to increasing body temperature will trigger cholinergic urticaria patient. They are exercising, hot shower, eating spicy food, also changes in the emotion like upset, angry, or stress. The time of onset of this cholinergic urticaria is at the second and third decade of life. There, there are a lot of reports saying that males are more susceptible than female for cholinergic urticaria. To date, there is no treatment for this cholinergic urticaria. There's only control and preventive medication like antihistamine to control the disease. However, treatment and epidemiology of the disease, as well as several clinical characteristics, has not been established in Malaysia. There are also too few or dogmatic reports, not to say clinical manifestation and pathogeneity pathway. The purpose of this study is to have better understanding of epidemiology of cholinergic urticaria in Malaysia. Also to collect clinical characteristic data to be used for medical staff as reference. Hopefully, the data of the result can be used as a stepping stone for clinical manifestation and pathogenesis study in the future. The experiment design in this study is the modification of a Kim and the Asamarai study. The sample size is calculated using this formula. Is 1.96 is the 95% confidence level score, Z score. So the 0.02 is the margin of error of 2%. 0.1 is the 10% of cholinergic urticaria population, and 0.9 is the non-cholinergic urticaria population. The study will be using or recruiting 865 patients, the age of range 16 to 29 years old, recruited randomly from the asthma and allergy centers of General Hospital from all states in Malaysia. Next, what I have to do is to obtain approval letter from authorities of General Hospital or Minister of Health for these studies. After obtaining this approval letter, a modified version of questionnaire that's done by me will be administered or contacted by phone to 865 patients from General Hospital from all states in Malaysia. The questionnaire will be comprised of three sections. The first section will be general characteristics, consists of the gender, birth year, height, and weight of the patient. And then the section 2 is the history and sign of the patient and the parents, whether they have got asthma, allergic rhinitis, and atopic dermatitis previously. Section 3 will be the patient's disease related. When is the time of onset of the cholinergic urticaria of the patient? How long does the symptom last, the duration? How is the distribution of the red wells on the skin? Also the morphology of the well and any the other aggravating factors that trigger the disease. After the data have been collected, it will be analyzed using SPSS version 26.0. The symptom prevalence rate will be analyzed for all participants and stratified by age group and sex. The differences between categorical variables will be assessed using t-test for continuous variable and chi-square test for dichotomous variables. The relationship between allergy disease and the cholinergic urticaria groups will be evaluated using logistic regression model. Other demographic informations and clinical features of patient will be presented as mean in range or number in percentage. The expected outcome of this study will be male will have a higher percentage of affected by cholinergic urticaria compared to female. Also, the patient and parents' history of allergy, asthma, and dermatitis will increase the percentage of patients affected by cholinergic urticaria. Clinical feature-wise, the most of the patient will experience heat wave highest on the trunk and upper body, followed by face and scalp, and the lowest is the lower body. The morphology of the uh, type of lesion, the highest will be non-follicular type of lesion, followed by follicular, mixed type, erythema without wheals, angioedema, and others. The aggravating factors highest will be exercise, followed by bath, hot and spicy food, stress, and others. Thank you. Thank you for listening to my presentation. These my references and this my appendix for the questionnaire. Thank you very much.